Good morning. Today is Saturday, February 17th, 2024. This is our virtual yoga therapy class. Let me check the sound now. This is check, check, check. Perfect. And Linda is also here. I hope Linda can say sound is good. So I can start. I'm here in town, so as I said, as long as I'm in town, I'm here. As you know, it used to be a in-person presentation. Now it is virtual. So we are taking the request, and today's request is very interesting. It's a request from a physician friend. He wants to practice pranayama for his diabetes. So today's will be pranayama practice for diabetes. And as usual, I'll come with the pathophysiology of the disease, what the diabetes is causing. And as you know, yoga therapy is the therapy at the root cause of the disease. So we'll practice the pranayamas which are curing the root cause instead of just giving you medication to lower the blood sugar. Now, I get this request all the time, especially from my physician friends now. I just want to do meditation. I want to do meditation as a part of my yoga therapy. So my answer to them is yes, meditation is medication. In fact, we did the last Saturday program. Yoga therapy, meditation is a medication. We showed you how to do all the meditation. But before the meditation practice, you need to prepare your body and breath. Prepare your body with the asana called the Sthiram Sukham Asanam. Stillness, happiness in a pose. Anything, I'm sitting here on my kneeling stool, I'm still, I'm happy, and this is my pose, my asana. And breathing has to be completely, we call it effortless ease. Breathing out longer than breathing in, you will slowly enter into meditation. So next thing they come and said, we are getting into age group now, it's very hard to do asana practice. Can you do only pranayama? I say yes, but also you need to prepare your physical body with asana practice and do very mild, relaxing asanas, especially chest opening asanas, which essentially relaxes your whole body and mind. And the primary asana we do is called prayer pose to the back, called Paschim Namaskar. Now, next few minutes, let me go over with you the pathophysiology of diabetes, so you will understand where we are coming from our treatment standpoint. The first today, from our Western medical concept, diabetes is a part of a syndrome called metabolic syndrome. Metabolic syndrome is the outcome of our stress. Stress is called sympathetic overdrive, and it creates a cascade of phenomena which is called metabolic syndrome. And primary phenomena is with the level of stress, you secrete a hormone called a cortisol. Also, stress affects the area of the brain called limbic system, amygdala and hippocampus. Limbic system sends a signal through neurotransmitter through hypothalamus for homeostasis, or we call it homeokinetics. It sends a signal again, hypothalamus, to pituitary adrenal axis to correct our hormonal imbalances, which is primarily the elevation of cortisol. Cortisol is like a steroid, and your alteration of the autonomic tone with an increasing sympathetic tone and decreasing parasympathetic tone. Cortisol then in turn causes the increase in the blood sugar, and we'll come back to you, but also what it causes truncal obesity. Cortisol thinks, it is called a thriftogen hypothesis, thinks that there will be no food tomorrow. So it converts the sugar, which is the end product of our diabetes, into a fat which is inside our abdomen, which is called a omental fat. Omental fat acts like an endocrine organ. It secretes adiponectin, it secretes pro-inflammatory molecule. And the inflammation is the root cause for your diabetes, hypertension, coronary artery disease, dyslipidemia or high lipids, high cholesterol, high lipids, or dyslipidemia like high triglyceride and low HDL. So this combination of truncal obesity, diabetes, hypertension, heart disease, and dyslipidemia are called metabolic syndrome. So previously it used to be a heart disease, you have all the risk factors. Risk factors are diabetes, heart disease, but now it is all together. Today have a diabetes, tomorrow you'll have a heart disease. Today have a hypertension, tomorrow you'll have a diabetes. Is what chicken come first or egg come first? So in a metabolic syndrome, we can talk about all. The primary thing is your diabetes. In diabetes, the cause, what happens, now in Western medicine, you will always hear about called insulin resistance. You have enough insulin being produced by beta cell of pancreas, and insulin is not properly working at the receptor site. Now let's go back to the phenomena of both yoga and Ayurveda philosophy. In yogic philosophy, the stress increases cortisol. Cortisol is the hormone which resists the function of the insulin to the liver. That means liver is resistant to insulin work, so liver starts breaking down. It's a storage called glycogen. It's called glycogenolysis. Now, as a physician, what we see, if you give a steroid like a prednisone to a patient, the blood sugar will go high up. And if you give a prednisone to a patient who has a diabetes, you will see the boom, blood sugar will go way, way high up. So the stress itself is causing increase in the blood sugar through the phenomenon of cortisol and insulin resistance in the liver. So the pranayama practice will be quiet down your mind, and we'll come over and do the practice. What is mind and how to control that. Second, if you understand Ayurveda, Ayurveda talks about diabetes is a poor digestion. Body cannot digest your sugar, so sugar is high up. As simple as it is. Digestion is carried out by, called a Jathar Agni, the digestive fire in your stomach, and this is called a Manda Agni. Your digestive fire is low, so you need to increase your digestive fire to cause proper digestion of the sugar, so blood sugar will come down. So in Ayurvedic standpoint, the diabetes or whole metabolic syndrome is a Manda Agni, Agni is low. High Ama. Ama is the end product of undigested food. When the food is properly digested, it converts into Saptadhatu, 7 tissues, and then the Oja. So when digestion is not proper, what happens, you develop ama, so it's a high ama which blocks the nadis, so prana cannot flow and you get the dis-ease. And the end product is the oja, so oja is not producing, it's a low oja. Low agni, high ama, low oja is the classic of your diabetes. So we do what is called agni deepan. Agni means your digestive fire, deepan is mean fire. You ignite your agni. Third, the pancreas itself probably is not working properly. So in yogic tradition, if you massage the organ, it improves its function. Massaging is done by a lot of asanas, like your, say, a spinal twist, vakrasana, because pancreas is laying at the end, at the posterior part, like at the back of your, close to spine. So any spinal twist, spinal manipulation also massages your pancreas, and basically it is squeezing the pancreas and gets its juices and insulin out. Massaging pancreas. Finally, in Western concept, it is your insulin resistance. Means insulin is not working at the site of its receptor. So that is called your malfunctioning cellular malfunction of your cellular level. So in yoga practice, what do you talk about? A simple, I just always say a grandchildren's understanding simply is, when the person is dying, we call it a person expired. Means the last breath comes out, lung stops. When the lung stops, next is the heart stops. When the heart stops, then the brain stops, because there is no perfusion in the brain. When the brain stops, all the cellular function stops. And you are pronounced dead. So if you reverse it, if you improve the lung function, you improve your heart function. Improve your heart function, then improve your brain function. Improve your brain function, improve your cellular function. So improve the function of the beta cells of the pancreas to have more insulin, and also improve the cellular function so insulin can act properly at the receptor level. So improve the lung function, primary pranayama we do, it's called a Bhastrika or bellow pranayama. So essentially in our daily practice, after asana practice, we do a set of pranayama. Then we do it first. Lung is like a balloon. It has 6 liter capacity. It only needs 1.5 liter to keep it open. So 4.5 liter air can be exchanged, what is called a vital capacity. But normally what we breathe in and out is called a tidal volume, which is only about 500 cc. So you have 80 to 90% reserve in your lung. So in all yoga practices, you learn how to breathe out. When you breathe out, you make some room for your lung. Now you can breathe in, and the breathing in is also very slow and long, and slowly it becomes longer and deeper. Normal breathing cycle is about 15 to 16 per minute, and if you can do a breathing at a rate of say 4 seconds out and 2 seconds in. So one cycle is 6 seconds, so your number already dropped down to 10. We've been practicing for a long time. We easily can do 4 second in, 8 second out, 8 second in, 16 second out, 10 second in, 20 second out, effortlessly. All the pranayama practice for a therapy should be done effortlessly as if it's a normal breathing. So, we generally practice pranayama, especially for the patient group we are talking about, sitting in a chair, or for me, I'm sitting in a kneeling stool. I think most of you have seen when I sit in a kneeling stool, I sit in a kneeling stool and put my knees, my spine straight. The first posture for your pranayama practice is straight spine. You sit down with a straight spine. Merudanda Achal. Then you quiet down your mind for an effortless pranayama practice, which is called manasthiti. So sit in a chair. If you sit in a chair, you will support your back, but your spine will be straight. Do not do this. Do not do the hunchback. Second, as I said, pranayama practice will be as if it's a normal breathing. People come and say, oh, pranayama should be taught properly. Pranayama is dangerous. It is going to hurt you. Yes, it is going to hurt you when you are going to give you a challenge. It says if 1 is good, 10 is better. If you give them a inch, they take out a foot. No, you do it as if it's a normal breathing. So I recommend sitting in a chair. If you're in the ground, you can sit down in a cross-legged pose, Sukhasana, Siddhasana, Padmasana, Lotus. Or also what we like, I like a very nice posture, is sit down with your back to the back, with your back against the wall, with with your Baddha-konasana. So, like or Titli-asana, like a butterfly, So go or sit down all the way to the back and get supported in your back. Because what happens when you're doing a pranayama practice, your muscles will start to relax. Believe me, we are so used to with the tightness of the muscles in our back. When the back muscle starts to relax, we also start feeling a little bit of a discomfort, almost like a little bit of a pain. So I will be sitting with a Titli-asana, or you call it a Baddha-konasana, and it will come down very soon. The tightness will go away and head back. Very nice posture for your pranayama practice. Or just a simple Siddhasana, Sukhasana, Padmasana. So the group of people we're talking about who are in a age group, mentally, they have been always sitting down in a chair and always sitting down at the table. They're not comfortable, so they'll be sitting in a chair. Getting up without a support. This is your health. So, let's sit down in a chair. Again, go all the way to the back. Go all the way to the back. Keep your back straight. First pranayama is, as I said, Merudanda Achal, mind straight, manasthiti. Quieting down the mind is a mudra. Hand gesture called mudra. Mudra connects your body and mind. Mudra is a connector between, called a neurophysical connector. This mudra, Dhyana mudra, Jnana mudra, you can put over here. Mind in yoga is a content of your five senses. I hear, I see, I smell, I taste, and I touch. Fifth limb of yoga is called pratyahara. Pratyahara. Prata means reject, ahara means intake. When you reject the intake means not the eating food only, it is through all the five senses. What you hear, what you see, smell, taste, and touch. Beautiful pranayama is a Brahmari pranayama or bumblebee breathing. So the first pranayama practice breathing we do, sitting down, breathe out first. Slowly breathe in without any effort. And breathe out longer than breathing in. Breathing out is parasympathetic, breathing in is sympathetic. When you have a parasympathetic tone, when you have a relaxation response, you have a saliva in your mouth. If you get a saliva in your mouth, like for me, I'm talking to you, my mouth is very wet, my mouth is full of saliva. Because I am in a parasympathetic activation mode. And also your whole digestive system, from mouth to the anal canal, all are supplied by your parasympathetic nerve. So parasympathetic tone is called calm and digest. Slowly what you need to do, and generally we say keep your spine straight and your eyes closed. If you close your eyes, you can visualize your breath. Slowly you will see you develop what is called neuroplasticity. Today you can do 4 seconds out, 2 seconds in. After a few weeks you will be able to do 6 seconds out, 3 seconds in. We can easily do 8 seconds in, 16 seconds out. Let me show you one technique. You will need to practice. I'm showing you how to begin a pranayama practice. Let me show it to you. 8 seconds in, 16 seconds out. The count of 8 in, count of 16 out. First, you need to breathe out and empty the lung. This was 8 seconds in, 16 seconds out. I'm talking, I'm even singing. That is a sign of my effortless breath. So for the mind, quieting down the limbic system, first pranayama we recommend the Brahmari pranayama. Then you do a chanting pranayama called Om pranayama, or it's called your Pranabha pranayama, A, Uma, and also we call it a Murcha pranayama. Murcha means unconscious. Now, when you do the pranayama practice, we do a sequence. The sequence we do at the beginning a Bastrika pranayama, 3 to 5 minutes. Then you do Kapalbhati pranayama, breath of fire, for 5 to 10 minutes. Then Anulom Vilom pranayama, alternate nostril breathing within 5 to 10 minutes. Then you do your Brahmi pranayama, bumblebee breathing. Do a Ujjayi pranayama to improve your tone, vagal tone, and to help you with your sleep apnea. Then you do a Om pranayam, chanting pranayam, pranabha pranayam. Then you do a lot of other ones, like a Shankha pranayam to improve your function, lung function. Then we do your Sitali pranayam, Sitkari pranayam, Shodhan pranayam, the cooling pranayam, then Plavuli pranayam. Okay, so since we are coming into the cause of the diabetes, let's do the practice according to the cause. So we are going to correct the disease at the root level, not a band-aid or tertiary level. So the quieting down the mind, the first pranayama is your Brahmi pranayama or bumblebee. Why? It shuts down your 5 senses, then it creates a vibration. Our brain, in fact our whole body is also in a state of vibration, and those vibrations are shown in your so when you record the EKG for the heart or EEG of your brain, the waves you will see, that is basically a recording of your vibration. So 2 vibration interacts, cancels, it is called a harmonic resonance. So the mind quiets down. So practice, if you want to do with me, you put your index finger in the forehead, you put your 3 fingers to close your eyes, or you can use the Shanmukhi Mudra and use your thumb to close your ear, close your mouth, literally shutting down your 5 senses. Then you breathe out first, take a deep breath in and breathe out with the sound of a bumblebee. Generally we do between 3 to 5 of this Brahmi pranayam, but let me show you just one time just to show how to do it. Then you will be able to do it. And this is all about relaxation response. Breathe out first. Deep breath in. Follow this with thumbing and cupping. Rub your hands, rub your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses. Make the hand like a cup, put it over your eyes. Let the eyes take all the heat from your hand. The heat will relax your eyes, the ciliary muscles. Your lens becomes more convex. When this becomes more convex, you're able to see better. When you're able to see better without using your reading glass, really the stress level goes down. Eye is also supplied by 4 cranial nerves. Retina by optic nerve, SO4, LR6. Two muscles, superior oblique muscles supplied by fourth cranial nerve, lateral rectus by sixth cranial nerve. Then you also have a branch of trigeminal nerve and also some of the facial nerve. So a bunch of cranial nerves comes to the eyes, so all quieting down the eyes. Massage your forehead, massage your eyes, massage your face. The muscles in the forehead and the face are all attached to the skin. So when they relax, the frowning goes away, all the line goes away, and all the lines in your face goes away. Looks like your face becomes tightened up, looks younger, looks like you are glowing. That is called the Kapalbhati. We'll talk about it a little bit later. There is a light around your face, which is an aura. Take your hand, massage your earlobe, massage behind the ear. In fact, you can massage inside your external auditory canal. There's a branch called the auricular branch of vagus nerve, vagal activation, which is a parasympathetic activation. Hand comes down, massage the both sides of the neck. These are called massaging carotid sinuses. Carotid sinus is supplied by your glossopharyngeal nerve, but in fact it is the activation of the vagal tone, parasympathetic tone. It quiets down your cardiac function and neurological function. In fact, when you have a cardiac event, very high, like a supraventricular tachycardia, we do a carotid sinus massage. Take the hand to the back, you bring it up to the occipital tubercle, you massage the two muscles, trapezius and sternomastoid muscle, both are supplied by cranial nerve. It's a wonderful practice, and you'll see how beautiful your mind quiets down. Quieting down the mind is the next one, is your alternate nostril breathing, which balances both sides of the brain. Our mind is not in a state of calmness because I'm right-handed, right-footed. I'm always using right hand, right foot. So my left side of the brain is active, my right side is not doing anything. I always use my left hand, always use my left side because I'm right-handed to create a balance, and alternate nostril breathing will balance your both sides of the brain. Use your left hand, Dhyana Mudra or Jnana Mudra. Use your right thumb just under the nostril. You don't have to squeeze all the way down to close it. Gently close it. Close your eyes. Keep your spine straight. Breathe out first through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. Same principle, breathing out longer than breathing in. Left nostril is supplied by the right brain. Right brain is intuitive, right brain is female, right brain is cooling, right brain is parasympathetic. Left nostril breathing is called parasympathetic cooling. We call it a Aidanari. Right nostril is controlled by your left brain. Left brain is analytical, heating, sympathetic, made. So right nostril breathing is called heating, sympathetic. It's called Pingala. So right nostril also activates your left brain, and left nostril activates your right brain. able to do alternate nostril breathing very simply. And if you see somebody's hand, you know how long they've been doing alternate nostril breathing. So simply breathe out here to the right nostril. Breathe in through your right nostril. Close it with the thumb and breathe out through your left nostril. If you feel discomfort on this arm, I recommend if you can support it, is good. If not, you can use your other hand and using the same mudra, other hand, and support it, so it gives you a little help. Next, with the eyes closed, put your index finger and the middle finger in your third eye and bring your awareness there. And make it called a super brain yoga supercharge. You can use your left hand and hold onto your right earlobe that has been crossing and touching the earlobe. Do super brain yoga and keep doing alternate nostril breathing. Within a short time, you will have no idea where you are, what you are doing, and what level of your consciousness is. Your mind will be totally on this third eye. Keep doing it until you have any effort. If you don't have any effort, 5 to 10 minutes is good. Generally in a daily practice, we do 1 hour of practice, 25 minutes of asanas, 25 minutes of pranayama, and 10 minutes of meditation. Generally for a pranayama practice, we start with, as I showed it to you, called your prayer pose to the back. When you put a prayer pose to the back and keep your hand there, you relax all the muscles of respiration. In fact, relaxes your whole body and mind. In an alternate nostril breathing, when your mind quiets down, you enter into almost state of meditation. This is called meditative alternate practice. You enter from your physical body, called Sthula Sharir, to a causal body, called Sukha Sharir. When you enter into a causal body, you can access your body with eyes closed. My eyes are closed, I can touch tip of my nose, I can touch the top of my head, I can touch my left shoulder, I can right shoulder, I can touch my left great toe. You will be able to do alternate nostril breathing without closing your nostril. Let's practice. Hands in a meditation mudra, dhyana mudra, jnana mudra. Spine is straight, eyes are closed. Bring your awareness to your left eye, left nose. Breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. Initially it looks like almost an impossible practice, but to practice with the eyes closed, you'll be amazed. When I have a microphone, I put the microphone in front of the one nostril and you'll see the air is coming out from one nostril. Meditative alternate nostril breathing without closing your nostril. Then you proceed a little bit more, which is very good for your mind control and also lung function. It's called Nadi Shuddhi Pranayam. Nadi means channel. Channels are got cleared, and that means called a high ama. The ama which is being there in diabetes, closing your channel called Nadi, Nadis gets cleared up. Nadi Shuddhi Pranayama is a breath holding in inhalation with a ratio of 1:4:2. 4 in, 16 hold, 8 out. Then you can slowly increase it, 5 in, 20 hold, 10 out, 6 in, 24 hold, 12 out. Let's show you the first time. Use a mudra. Bring your middle finger and ring finger down. Make a pinch with your little finger, ring finger and thumb. Vishnu Mudra. Put it over your nostril. Close your right nostril. Breathe out through your left nostril first. Breathe in through the left nostril with a count of 4 in. Hold your breath for a count of 16. Breathe out to a count of 8. One round of Nadi Shuddhi Pranayama. If you can improve a little bit more with the daily practice, let me show it to you. 5 in, 20 hold and 10 out. Breathe out your right nostril first. Breathe in with a count of 5 in. Hold your breath for a count of 20. Breathe out with a count of 10. Wonderful practice for cleaning your channels, Nadi Shuddhi Pranayama, and also quieting down your mind. Mind also gets quiet down with a practice called your Murcha Pranayama. Murcha Pranayama, basically breath holding in inhalation with a chin lock called Jalandhar Bandha. So Abhantarin Kumbhak. Abhantarin means inhale, Kumbhak is breath holding. See, inhalation is called Purak. Breath holding is called Kumbhak, and exhalation is called Rechak. Abhantarin Kumbhak is a breath holding in inhalation, and Bajya Kumbhak is breath holding in exhalation. Chin lock activates your carotid sinuses, and when you do your breath holding, your lung starts to expand. It comes to a position where you have the rib cages, so lung cannot expand anymore. So what happens at the time, it's called a Herring-Brewer reflex. At the level of the pleura and the lining of your lung, the vagus nerve gets active and it starts reducing the volume of the lung so it can stay within the rib cage. So what it is basically is an activation of vagal tone or parasympathetic tone. When you do the practice, you can do the practice with, as you call it, effortless ease. That should have effort in it. Chin lock activates your carotid sinuses. It's a profound level of relaxation and mind control, and that's why it's called a Murcha Pranayama. Murcha means almost unconscious. Meditation mudra again. Breathe out first. Take a deep breath in. Hold your breath. Slowly drop your chin down, touch your chest and hold your breath. In fact, you will almost fall asleep. Are people who does this practice at night before going to bed. So your blood sugar started to coming down by able to quieting down and controlling your limbic system. Next is your Manda Agni. Your digestive fire is low. So it is called your pranayama, is called your Agni Pradhan Pranayama. Agni means your digestive fire, Pradhan means it affects your digestive fire. It also called your metabolic pranayama and it's called your Kapalbhati Pranayama. Word stands for Kapal means forehead, Bhati is shiny. That means when you ignite your digestive fire, you ignite your Teja. Teja is your actually the glow within you. So you're glowing. So when you practice, you already say, oh, you look younger. You know, when did you have your facelift done? It's amazing. Well, look what you get. Kapalbhati Pranayama basically is just saying, keep your spine straight, awareness here, push your belly button in, it hits the diaphragm, hits the lung, air comes out. Generally practice Kapalbhati Pranayama with your all the mudras. Dhana mudra, Jnana mudra, then the Vayu mudra, it's called Shunya mudra. It helps your hearing. Prithvi mudra for grounding, for diabetes, obesity. Varun mudra is for your bladder function, improving your water content. This is called a Shakti mudra. Little finger, ring finger and thumb. Apna mudra, Pachan mudra, ring finger, middle finger and thumb. This is a digestive mudra, Pachan mudra. Put your index finger down, it's called Hridaya mudra, to improve your cardiopulmonary function. A lot of other mudras, you know, like your Ganesh mudra, is Linga mudra, but we generally do it about basic 8 or 10 mudras. We do about, for our practice, we do about 50 with each mudras, but I will show you maybe about 10 each in a mudras. So when you do that, so you relax your body and mind, close your eyes, bring your awareness in your belly button, push it to the back. Nothing is there, it's just hold that. Somebody says, I cannot do it. So if you put your one hand in your bag and put your other finger, see, you'll feel the air is coming out. If you cannot do it, what you can do, just I teach them, why don't you cough? Now try to cough with your mouth closed. Becomes Kapalbhati Pranayama. It massages all of your internal organs. So massages your stomach, which ignites your Agni, massages your pancreas to improve your function, massages rest of the organs, massages your lung, massages your heart, increases your teja. It helps your digestion. And Ayurvedically, the pitta time is between 10 to 2, that is your main meal, the lunchtime, and you get a tikna Agni, a high Agni at that level. So let me show you how we practice Kapalbhati Pranayama. We start with the Dhyana Mudra and close our eyes, spine straight. I'm going to show you 10, but generally we do about 30, 40, 15-ish mudras, but a little 10. Vayu Mudra is massaging my liver. So liver function gets better and insulin able to start working on my liver irrespective of high cortisol level. This improves your Vata, balances your Vata. Shunya Mudra, it improves your hearing. Massages your stomach. Stomach is the site of your Agni, ignites your Jathar Agni. Fire in your stomach, helps with your digestion, basically increases the parasympathetic tone. At the level of your gastroesophageal junction, with the esophagus and stomach meets, there is a 2 vagus nerve. The right vagus is the posterior part, left vagus is the interior part before it branches and supplies the whole gastrointestinal system. It also massages your vagus nerve at the gastroesophageal junction, the parasympathetic tone. Proof of it, look at my mouth. My mouth is completely wet with all the saliva. I've been talking to you almost close to an hour, but my mouth is still extremely wet with saliva. Prithvi Mudra, for grounding, is very important for kapha, balancing kapha, good for your diabetes and obesity. Massages your spleen, massages your pancreas, very important. Massaging pancreas brings its function back, improve your diabetes. Varun Mudra, improve your bladder function and the fluid-related disorders like congestive heart failure, kidney failure. Massages your colon. Massages your small intestine. Massages your rectum and anal canal. For women, massages your uterus. Massages your ovary. Massages your fallopian tube. Very good for your infertile couple. Shakti Mudra. Little finger, ring finger, a little finger, middle finger and thumb. No, little finger, ring finger and thumb. This is to improve your strength or Shakti. massages your bladder. For men, it massages your prostate. It massages your diaphragm in upward movement. Apna mudra, pachan mudra, called a digestion mudra. It digests everything because it moves all the apna vayu. Massages the both sides of the lung. So all the air comes out from the lung, which is the residual air, so makes more room in the lung, so you get it better for your lung function. Apna Vayu Mudra, put your index finger down. The Apna Mudra, it is also called Hriday Mudra, good for your heart. And in fact, when you do Kapalbhati Pranayama, in between the lung is the heart. So massaging the heart from the bottom, gentle massage. And as you know, if you have any problem with the heart function, we massage your heart. We do CPR, cardiopulmonary resuscitation, basically massage your heart. Massaging your heart from inside. So almost like what you call an internal CPR. Wonderful practice. If you Linga Mudra, this is very good for your bringing the flame out, phlegma out. The children you'll see, they will always do put this. Yeah. So quieting down your mind, improving the Jఠar Agni so that properly get digested, and also improving the function of the pancreas with the same pranayama, Kapalbhati Pranayama, which is called your metabolic pranayama. It also helps to do called your Uddiyani Bandh, which is abdominal lock, followed by Agni Sarkriya movement. So this is a massaging all the abdominal organ, including your pancreas, and also able to hold. Breath holding in exhalation is a wonderful sign for your health. Technique is we breathe out first. Generally we do after Kapalbhati Pranayama. Breathe out first. Take a deep breath in, completely breathe out. Suck your stomach in and hold. Generally, breath holding in exhalation, well, half the time of breath holding in inhalation. And it is an absolute must practice. As we say, we yogi, we never leave home without doing that. Uddiyani Bandh and Agni Sarkriya. We'll show you one time how to do it. So you'll be able to see it. Breathe out first. Deep breath in. Completely breathe out, suck your stomach in and hold. Uddiyani Bandh, we incorporate Jalandhar Bandha. So incorporate Jalandhar Bandha, it is a activation of your carotid sinuses, and here it is basically the negative intra-abdominal pressure, and the negative intra-abdominal pressure helps better perfusion of the organ. This follows with your called Agni Sarkriya. Do the same phenomena, suck your stomach in and abdominal wall in, then use the abdominal wall to massage all the organs. Breathe out first. Deep breath in. Agni Sarkriya. Agni is your fire, digestive fire. Sara is the essence. Kriya is your action. Agni Sarkriya. You know, people with a truncal obesity. I know the reason I'm doing this because I get this request. Oh, this is my friend. He was doing this Kapalbhati Pranayama, this Agni Sarkriya. We lost 20 pounds. His blood sugar came down. He's off medication, off insulin. I mean, it's amazing stories we hear. This is the treatment for your truncal obesity. This truncal obesity is due to your high cortisol, which is due to your high stress. This is a manifestation of stress. And the stress is from your wealth. When you have too much money, and I don't know if you do the common term. Yeah, when you become wealthy with your money, you start expanding your waistline. And it is resistant to your diet and exercise. People come and tell me, oh, I'm 82, I'm 85, I'm 75, I'm developing this. I'm developing this because of your cortisol, because of the stress. So finally, last is your cellular function, which is your insulin resistance. Insulin resistance means your cellular level is not working. So you have to improve the cellular function. Again, improve the lung function, improves your heart function, it improves your brain function, cellular function. As simple as it is. And always remember that we always practice with our health tracker, so we know our physiological changes, what is going on. So the two pranayama, the basic pranayama, which really helps you, is your Bhastrika pranayama, the bellows. Bellows is an active inhalation, active exhalation. In fact, Bhastrika pranayama is the gateway of the pranayama. We start Bhastrika pranayama. The sequence we do for a daily practice, we do Bhastrika pranayama first, then we do Kapalbhati pranayama, followed by your Uddiyani Bandh, abdominal lock, and Agni Sarkriya. Then we do an alternate nostril breathing, an alternate nostril breathing followed by a Nadi Shuddhi pranayama or a breath holding, then we do little chanting and called Pranayama pranayama. So we will end with a Pranayama pranayama and also with your a Ujjayi pranayam with chin lock and a left nostril breathing. One of the most profound relaxation response, and we say money back guarantee, your blood sugar will come down. In active inhalation and exhalation, it is simply written there, you can say, you got to inhale and exhale. It's like your bellows. In fact, what you do, if you do inhale and exhale, later on we'll do inhale and exhale. So balance it. Always yoga practice is the balance, like inhalation and exhalation. Next will be opposite, inhalation, exhalation. We practice generally raising your hands high up. You need a very slow speed initially. When you cannot do it, breathe in, breathe out. And when you breathe out, you always close your hand with the Adhi Mudra, called your Bala Mushti Mudra or child fist. With a slow speed, which is called your Ishwar, medium speed, which is called your Soham, and high speed we call it Vishnu. In our practice we do 20 of each, 20 slow, 20 medium, 20 fast, like a one cycle, then you continue cycle, one cycle, two cycle, three cycle for a daily practice. Let me show you with a 10 of each, so understand how to do it. Then we'll do another way without raising the hand, and that we can do in hundreds, 100, 200, 300, 400, 500. So first, slow, 10 of them. Medium speed, Soha. Rapid speed, Vishnu. So 20 each will complete one cycle and will complete the cycle. Improves the lung function, improves the heart function, brain function, cellular function, and the insulin resistance goes away. It's also done without raising your hand, just simply putting your Adhi Mudra on your shoulder, on your knees, and just raising the shoulder and doing active inhalation and exhalation. Let me show you a few hundreds, and you will be able to continue. So I'm not doing the whole practice because of the lack of time, but I'm showing you the techniques how to do it, so you'll be able to do it. And remember, when you keep on doing it, time flies. Here I'm talking, I'm explaining, that's what time is. Here it will be like this. I did 250 of them. I'm still talking, I'm singing, I'm effortless. We do generally in our practice, you almost 500, 600 of them without any effort. It's wonderful practice. Also, in our practice, we do a very hand raise in a one speed as long as we can, without any effort. Generally, you can easily do about 100 like this. Easily you can do 100 of them. We're going to keep on doing it. Shankha pranayam. Shankha pranayam is like blowing a conch shell. Blowing a conch shell, it improves your lung function. So what do? You generally use your hand. Use it on Adhimudra. And always remember, we do all the pranayam through our nose. We don't through any mouth breathing. God gave us mouth to talk and to eat. Because if you breathe in through your mouth, you have no idea where the air has gone. Gone into the lung or in your stomach. If you breathe through your nose, air goes through your nose. Nose is like it's a filter. It filters your outside dirty air. Nose is like a personal air conditioner. Outside air is warm, it will cool it down. Outside air is cool, it will warm it up. Air goes through your side of the nose called a turbinate, creates a vortex, goes over the mucus of your sinuses, releases a substance called a nitric oxide. Nitric oxide is a potent vasodilator, activation of your parasympathetic tone, also like acetylcholine and cyclic GMP. Goes to the behind your throat, upper part of the lung, lower part of the lung. So it is all the air goes into your lung. Nothing is going to your common channel. If somebody says, I have to do mouth breathing. If you have to do mouth breathing, you can always breathe out. Still, then you lose the function of the muscles of expiration, the muscle which helps you to breathe out. We use the mouth as a breath to cool it down or to do a Shankha Mudra. So breathe out first, breathe in through your nose, blow through your mouth as if you are blowing a conch shell. Breathe out first. Deep breath in. This is the breathing with your resistive exhalation, like you are resisting your exhalation. Resistive inhalation also helps lung function, which is called Ujjayi Pranayama. In a Ujjayi Pranayama, you slowly close your larynx, try to breathe in through your larynx against a resistance. Larynx is supplied with the two laryngeal nerves called superior and inferior laryngeal nerve, which are branch of your vagus nerve. So able to slowly constrict in a relaxed way, we activate your vagus nerve. The signal goes into your brainstem, and the output signal comes out through a glossopharyngeal nerve, which goes into your soft palate. It supplies the two muscles called palatopharyngeus and palatoglossus, tightens them up. It stops your also snoring. Outflow also comes from your hypoglossal nerve, supplies your tongue, pushes the tongue in front. It helps in your relieving your sleep apnea. You don't need Inspire. You don't need a CPAP machine. So generally you do at that breathing in and out, you call it a dark weather breathing or a ocean breathing. Slowly you will be able to do it by almost closing the larynx like this. It also helps your thyroid function. When you're able to do it a longer time like this, it will be like this. When you get a cough, it is normal, but the cough comes from that area where you are constricting in Ujjayi Pranayama. And when you get a cough, that means you are affecting the right place. If you notice it, I did a Ujjayi Pranayama, that I incorporated the chin lock, Jalandhar Bandha, and I did a left nostril breathing. One of the most calming, cooling, controlling your limbic system and lowering your blood sugar and controlling your metabolic syndrome. Finally, we'll finish with call it Pranava Pranayama. There is a lot of other pranayamas also, Savitri Pranayama, that is 1:2:1, the relationship. But Pranava Pranayama is a component of A, U, Ma. A comes from the lower part of the lung, U comes from the middle part of the lung, Ma comes from the upper part of the lung, and it also associated with the mudra, first called a Chin Mudra. Chin Mudra is like your meditation mudra, Dhana Mudra. Meditation mudra, palm is up, Chin Mudra, palm is down. When you close the other fingers, this is called a Chinmay Mudra. It helps your middle part of the lung. So Chin Mudra helps in your lower part of the lung, Chinmay middle part. Then you do Adhi Mudra, which helps your upper part of the lung. Chin Mudra. Chinmay Mudra. Adhi Mudra. touch your little finger and thumb. Separate your middle finger, ring finger and thumb, middle finger, index finger, middle finger and ring finger. Lotus mudra, Padma mudra. It connects your body, mind and spirit. Bring it close to your heart. Heart is the site of your soul. We always say memorize by heart. Once your soul or with mind quiets down, blood sugar comes down. Put your hands in front and give a gesture of your head down. Say namaste. Namaste basically means I honor the divinity within you. You are divine. I respect you. The moment we keep the divinity and the moment we stay calm in the middle of crisis, blood sugar doesn't go higher. Blood sugar goes up because we are in a state of sympathetic overdrive. Thank you for joining. If you have any questions, comments, please put it on Facebook. I'll be glad to answer for them. Next week, probably I'm going to be out of town, but I will let you know through my Facebook page. And if you have any comments, please let me know. And if you have any question about pranayama for diabetes. Okay, see you soon. Bye-bye.